I'm Dr. David Beaulieu with more news you can use. I want to talk to you today. Geez, some of you are thinking probably, here he goes again, but I am, on heart disease, cancer, and sugar. More than 1,660,290 new cancer cases are projected to be diagnosed in the U.S. this year. That's a lot. And an estimated 580,350 Americans will die from the disease. Another 600,000 Americans will die of heart disease each year. At present, heart disease is the leading cause of death among both sexes. You know what's worse? Virtually none of the conventional strategies actually address the root cause of the problem: a flawed diet, high in sugars and processed foods. Now, folks, I've been at this for 46 years. Got out of school in 1968. I'm telling you the truth. This is what I've seen in my practice. People change their dietary habits. Everything changes. Don't wait till it's too late. Conventional dietary recommendations for the prevention of heart disease are diametrically opposed to what you actually need for optimum heart health. For over 60 years, saturated fat has been blamed for heart disease, resulting in the promulgation of a dangerous low-fat, high-sugar diet. In reality, a diet that promotes health is high in healthful fats and very, very low in sugar and non-vegetable carbohydrates. Research coming out of some of America's most respected institutions now confirms that sugar is a primary dietary factor driving chronic disease development. Sugar and fructose in particular have been implicated as a culprit in the development of both heart disease and cancer, and having this information puts you in the driver's seat when it comes to prevention. How much sugar is in your diet? Good question. Most of us consume about 150 to 200 pounds of sugar a year. We're supposed to, our body's designed to handle about 15 pounds of sugar a year. If I took 15 bags of S&H pure cane sugar and put them in my office on my desk, every patient who walked into my office would say, "Gee, doc, that's a lot of sugar." Our body's designed to handle that, but it's not designed to handle 10 times plus more. It's not designed to handle 150 to 200 pounds a year. It can't handle it. It makes us sick. And those doses, it is a highly toxic poison. Here, soda drinkers have increased cancer risk. Study included data from more than 23,000 postmenopausal women who were followed for 14 years. They had a whopping 78% higher risk for endometrial cancer. Wow. And fructose is worse than all the other sugars combined. This goes back to the late 1930s, early 1940s, where brilliant medical doctor Otto Warburg, Nobel Prize winner, by the way, MD, PhD in physics, did some research. Now, physicists and engineers aren't like us. We in medical research do research, and then we say we need to do more research because we're sloppy. Engineers and physicists, they do the research, and then they say, do it this way. It will produce these results. How do we know? We did the research. Physicists and engineers are different. When they do the research, they do it right. Warburg said cancers live on sugar. That's their primary food source. If you deprive them of their food source, they don't grow. If you don't create an environment for them, they tend not to show up in the first place. When did we start seeing this tremendous cancer epidemic? When we started introducing more and more and more sugar into the diet of those in the industrial world. It is no surprise that as sugar intake went up, cancer rate went up, heart disease rate went up. Now, Alzheimer's going up, diabetes is going up. This low-fat, high-sugar diet that we have been on is a disaster, you know? If that's hard to believe, argue with the science.